The White House is pointing a finger at the Trump administration amid growing confusion over the nation's vaccine supply. An estimated 21 million Americans have now been vaccinated. But more than 41 million doses have been distributed. That means nearly 20 million vaccines may still be sitting in freezers across the country. President Biden says the U.S. should soon be able to vaccinate 1 million Americans daily and says that number could even increase to 1.5 million. This as the U.S. confirms more than 25 million cases of the virus. The death toll now stands at more than 420,000. And new variants are spreading nationwide. A new and more contagious variant has been discovered in California. Officials have linked it to a surge of cases in the southern part of the state. That variant has now spread to New York and Washington, D.C. Jonathan Vigliotti leads off our coverage in Los Angeles.
Tonight, new concerns over the vaccine rollout. At its current pace, California won't vaccinate even half its residents until Thanksgiving. New York hitting pause on using stadiums as mass vaccination sites.
We don't have the supply of vaccine we need. We urgently need more supply.
Tonight, the White House is pointing the finger squarely at the Trump administration.
The confusion around this issue, which we acknowledge there is some confusion, speaks to a larger problem, which is what we're inheriting from the prior administration, which is much worse than we could have imagined.
Today, the president said his administration is getting a handle on supply issues.
I think it'll be this spring. I think we'll be able to do that this spring. But it's going to be a logistical challenge that exceeds anything we've ever tried in this country, but I think we can do that.
The CDC saying that of 41 million doses shipped by the federal government, only 22 million have been administered.
It's not easy to get doses from where you go in the vial all through the transportation into people's arms, particularly underserved communities, to get it to people. So if people think that's easy, it's not. It gets hard and it'll get harder.
For its part, Moderna, in a statement to CBS News, says we continue to be on track with our expectations of delivering 100 million doses of vaccine by the end of March. And there's new urgency tonight. California now has its own mutant strain, which, like the UK variant, is far more contagious. Researchers believe it began in July, mostly lying dormant and then exploding. By November, dominating new cases.
In Southern California, it's 40% now.
The good news for the Golden State.
There was a huge surge after Thanksgiving. There was less of a surge after Christmas, and there was even less of a surge after New Year's. So I think, we've now turned the corner in terms of new cases.
Today, Governor Gavin Newsom lifted some of the state's stay-at-home restrictions. Outdoor dining and hair salons among the things that will now return to 90% of state residents.
Does the governor risk sending a mixed message?
There's seldom a day goes by in government where you don't risk sending a mixed message. And you have to make small changes and make sure you don't overstep one way or the other.
But the surest way out of the pandemic is vaccines.
We have to step up our game. I want to get over this idea that we could get to 600,000 American deaths. That is unacceptable. I would consider that a national failure. This has to become the #1 priority for our nation.
The president says he hopes to up the doses to 1.5 million a day. Here in Los Angeles, the mayor announcing that restaurants can open for outdoor dining starting on Friday for what is the first time since Thanksgiving. Elaine?
Jonathan Vigliotti, thank you. For more, let's bring in Dr. Dara Kass. She's an ER doctor and a medical contributor for Yahoo News. Dr. Kass, welcome. Thanks for being with us. More and more states are seeing vaccine shortages. New York City had to pause plans to open mass vaccination sites. What will it take for states to meet the demand, and how much of this will depend on the federal government?
So it entirely depends on the federal government, not just in the delivery of the vaccine, but the delivery of the information about how much vaccine is coming. A lot of the reason that states are canceling appointments now is because they overpromised what they were overpromised. And so now they're actually getting less vaccine than they were told they were getting last week. And there's often only a 24-hour or 48-hour window between the time the vaccine, they're told how much they're getting and how much they actually receive. So making appropriate appointments for a population that's ready, willing, and able to be vaccinated, like we're seeing in New York, is very, very difficult and runs the risk of canceling appointments like we're seeing here.
Well, there have been some reports about hospitals throwing away unused and spoiled vaccine doses. What are you seeing on the front lines, and are you concerned at all about wasted vaccines?
So we're actually not seeing that really now in the last few weeks. We saw that a little bit in the very beginning when there was a confusion about how to distribute the doses, and more importantly, to have an expansive opportunity to distribute doses if people weren't showing up to their appointments. Now we're seeing that we're running short of doses, not throwing them out. A lot of the confusion was around how long you could store it, how you could transfer it, but more importantly, who was qualified. And so they would run out of qualified people to get vaccinated, and instead of giving it to somebody else that was just there, they would throw out the doses. Now we're much more willing to just give the dose to the person who's available instead of throwing out the dose because they don't fit some number in line.
Well, Moderna says that its vaccine should protect against the coronavirus variants discovered in the UK and South Africa, but the company is still working on a booster shot. Explain to us how these vaccines are able to protect against different strains of the virus, and why would Moderna want a booster?
So Moderna's planning for a situation we're not in right now, which is that there is another variant we haven't seen that may be more resistant to the vaccine. And remember, it's a continuum of protection. It's not that it's all protective or not protective. What they're talking about is, would there be a variant that there would be less protection than we're seeing with that 95% efficacy from the Pfizer and the Moderna vaccine? The other thing to remember is that the virus mutates when it spreads. So the reason they need to be prepared for new mutations is because of the unrelenting spread we're seeing all over the country. And the example is really present in California. Part of the reason that mutation took hold and was spreading so significantly through the population was because of how many cases were happening over and over again, and how many new people were getting infected, giving the virus an opportunity to mutate even further.
So I think you just answered my next question. Basically, these new strains are believed to be more contagious. We can't necessarily stop a virus from mutating. But what you're saying, if I'm hearing you correctly, doctor, is that the way to fight against the spread of variants until people are vaccinated is to just stop the spread of the virus, period, full stop, with those kind of mitigation measures that we've heard about for months.
It's that simple. If we stop the spread of this virus, we will stop the mutation of this virus. We will contain the new variant, and we won't need new vaccines. We will be able to develop, anticipate the strains coming out. We'll be able to track the new virus as it comes out slowly, but we won't be dealing with this massive, overwhelming number of cases in our hospitals and in our communities and risking shutting down our schools. So if everybody out there just thinks about the way to protect against new strains to keep our vaccines viable is to stop the spread of the virus in their community, we would all be working closer to bringing this pandemic to an end.
And Dr. Kass, before we let you go, I want to ask you about pregnant women, because as I understand it, there's no clinical evidence available just yet to guide doctors on whether to vaccinate pregnant women. So how do you advise pregnant patients who are concerned about contracting the virus?
So we know that the virus is more dangerous for pregnant women than for non-pregnant people. So we know the risk in getting the virus is more dangerous. The vaccine was not tested on pregnant people, but we know plenty of pregnant people that have received the vaccine. So many of my friends who are physicians and nurses who are pregnant have gone, looked at the data, and received the vaccine. The American College of Obstetrics and Gynecology says patients should be advised with their doctors to make a decision, but should not be prevented from taking the vaccine. So what I would say is a pregnant person should speak to their doctor, but I know plenty of doctors, nurses, and other healthcare workers who are pregnant who have taken the vaccine.
All right, Dr. Dara Kass. Doctor, thank you so much for your insight. Really appreciate it.
No problem.